Today we have to discuss about the topic is gingival enlargement in periodontal disease. Before going to the topic, we need some more basic. That is gingival anatomy. This is called as interdental papilla. This is called as a mucogingival junction, and this is called as a free gingival groove and a margin of free gingiva. The gingival enlargement is due to there is a interproximal space between the teeth. So this is the interproximal space, particularly the interdental papilla get enlarged both labially and lingually. As a result, gingiva get enlarged due to that accumulation of the bacteria. Various factors leads to that enlargement of gingiva. That is classified based on the factors, kind of factors. Especially in the inflammatory gingival enlargement is due to inflammation and drug induced enlargement associated systemic factors like conditioned enlargement due to systemic disease, and idiopathic gingival enlargement, neoplastic gingival enlargement, false gingival enlargement. There is a variety of cases leads to the gingival enlargement. First we to go to the topic is inflammatory gingival enlargement. It is due to local irritation such as poor oral hygiene, accumulation of dental calculus, and mouth breathing, dental plaque accumulation, etc. The dental plaque accumulation is due to the improper poor oral hygiene. As a result, the gingival enlargement occur. At the same time, the mouth breathing result, there is a drying of the gingival area. So the dried gingival area get frequently irritated, so the inflammatory cells are developed and that leads to the enlargement. This enlargement is very soft and edematous and sensitive to touch, can bleed easily, and a non-stable surface will be seen. What is stipple surface? The stippling means that is it look like a orange peel appearance. It is further we discussed about this topic stippling. The stippling is due to there is a projection of the connective tissues, will be seen the elevation, and there is a fusion of the ridges that leads to there is a depression is seen. So there is elevation and depression is seen in the cases that this leads to formation of stippling. The stippling will be always absent in the inflammatory conditions. So these conditions, inflammatory gingival enlargement have hyperemia, edema, and lymphatic infiltrate cells, that is inflammatory cells that is present in the gingiva, that leads to proliferations, because these inflammatory cells stimulate that various kind of factors, that factor to induce the fibroblast growth. As a result, gingiva enlargement occur. The drug induced is due to that three most common drugs pave the way for the gingival enlargement, that is anticonvulsant, immunosuppressant, and calcium channel blockers. This fibroblast synthesis that metalloprotease enzymes. That metalloprotease enzymes helps to degrade the collagens. So this metalloprotease enzyme was controlled by metalloprotease inhibitor. This metalloprotease inhibitor was completely stimulated by this phenytoin. As a result, metalloprotease inhibit completely the metalloprotease enzyme. So this metalloprotease can't degrade the collagen. As a result, increasing gingival enlargement. At the same time, there is a presence of integrin in the fibroblast. The role of integrin is endocytosis, that is phagocytosis the collagen fibers. So there is a loss of integrin, that is alpha 1 beta 1 integrin loss. As a result, there is no endocytosis occur. The phenytoin decreases that integrin, alpha 1 beta 1 integrin. So there is no endocytosis occur. So gingival enlargement also occurs. In immunosuppressant, the immunosuppressant drug, particularly cyclosporin, stimulate the fibroblast. As a result, gingival enlargement also occur. And calcium channel blockers, fibroblasts need folic acid. The calcium channel blocker block the block the uh, block the absorption of folic acid. As a result, deficient in folic acid, there is a mutation in the fibroblasts, so uncontrolled proliferation of the gingival growth will be seen in this condition. Anticonvulsant such as diaphragm phenytoin, 50% of patients having gingival enlargement, and phenytoin stimulate proliferation of fibroblast. Also, decreased collagen degradation occurs in mostly in young individuals. Cyclosporin, 30% of patients have gingival enlargement, and calcium channel blockers used 20% of patients having gingival enlargement. The calcium channel blockers mostly nifedipine, verapamil, and nitridipine. Due drug induced gingival enlargement is very painless. It looks like normal gingiva. The only defect is there is a roughened and pebbled surface, and recurrence also occurs. The patient aesthetically complaint is the only thing. Otherwise, it look like a normal gingiva. The gingiva is very roughened and pebbled surface with the lobulation also seen. There is no tendency to bleed, and no difficulties occurs, but aesthetically objectionable. And the oral hygiene is slower than the gingival enlargement. That is, for maintaining the proper oral hygiene, the gingival enlargement will be slow, and slow recurrence after surgery. Sometimes regression occur if drug can be stopped. Uh, in fact, the drug also stopped, but the enlargement occur in this case. The enlargement with systemic factors, that is condition enlargement by systemic condition of the patient. However, bacterial plague is essential for the initiation of the type of an enlargement. There is a three kind of condition for enlargement of gingiva. That is hormonal, nutritional, and allergic. These three conditions pave the way for the enlargement of gingiva. It is associated with dental plaque. The dental plaque inside the gingival enlargement and get developed. First, hormonal enlargement. There is a increasing level of estrogen and progesterone leads to increase in vascularity. Wherever the dental plaque get affected in the particular area of gingiva, that gets stimulated, and vascularity increased as a result, the formation of tumor in this area. So that is severe, called as a pregnancy tumor. This nutritional enlargement is due to deficiency of vitamin C. Vitamin C helps to the formation of hydroxyproline and hydroxylysine. This hydroxyproline and hydroxylysine helps to cross link between the collagen fiber. These collagen fibers naturally helps to pave the it act as a attach the platelet for prevent that blood bleeding. So the platelet get accumulated in the collagen fibers, that leads to blood clot occurs. But the collagen fibers is weak due to the deficiency of vitamin C. As a result, this as a result, this spontaneous bleeding will occur. At the same time, there is a immunity will also decrease due to lack of vitamin C. As a result, gingival enlargement easily occurred. There is a bleed on slightest stimulation. Gingival sulci is often filled with blood. This is a gingival sulci. The sulci is often mostly filled with blood and properly clotted. The crust of the area is look like very red or purple. Sometimes ulcers and necrosis will be seen in this area. There is a treatment is to improve the oral hygiene, and vitamin C supplement is the only treatment. There is allergic gingival enlargement is due to like dentifrices, mouthwashes. There is for hypersensitive reaction, those kind of toothpaste, etc. That leads to that the gingival enlargement. That enlargement due to systemic diseases, that is acute myeloid leukemia. Find in acute myeloid leukemia. In this condition, there is a lack of WBC proliferations So there are WBC involvement because this abnormal WBC is basically weak. There is no use to defend the bacterial against the bacteria. So the gingival enlargement occur. The bacteria get easily affected the gingiva. As a result, gingival enlargement occur. These granulomatous diseases also lead to the formation of gingival enlargement, that is particularly Crohn disease, Sarcoid disease, Wegener granulomatous stomatitis, interaction of foreign materials in the circular epithelium. In the Crohn's disease, it is a inflammatory bowel disease. That is a segment of inflammation in the intestines will occur in this case. As a result, at the same in the mouth. So the mouth having it is a swelling and erythematous and enlargement will be seen in the mouth. Sarcoidosis, there is a collection of small inflammatory cells in the area, particularly like this. As a result, it is also seen in the mouth. So that leads to the gingival enlargement also occurs. Wegener granulomatous it is due to presence of vascular inflammation or vasculitis infection in the vascular tissue. As a result, the gingival enlargement also occur. Interaction of foreign materials into the circular epithelium for development of leads to the gingival enlargement. In idiopathic gingival enlargement, before tooth eruption, the enlargement occurs under unknown etiology. Probably it is a hereditary. Fibromatous gingiva, elephantitis gingiva, congenital microgingiva is the other name of these diseases. This condition, the gingiva is dense, fibrous, and insensitive to as a sometimes the lip get protruded, delayed eruption in the tooth also seen. There is no bleeding will occur in this case. At the same time, the patient complains only the deformity. In fact, mild hyperkeratitis also seen in this condition. In this condition, the gingival fibroblasts will be densely arranged and bundles of mature fibrils also seen in the idiopathic inflammatory idiopathic gingival enlargement. At the same time, surgical removal of excess may also recurrence occur. To next one, we have to go to neoplastic enlargement. The neoplastic enlargement is due to benign malignant neoplasm on gingiva. Next, we got to go to the topic. That is false enlargement. Dense or osseous abnormalities that look like gingival enlargement. For example, fluid cemento-osseous dysplasia seen like gingival enlargement. This like. Thank you.